Hi, I'm Cindy Perlin. I'm the founder and CEO of the Alternative Pain Treatment Directory. And I'm here with Tim Chambers, one of our listed providers. We're going to be talking about trigger point therapy and myofascial release therapy for chronic pain. Tim he holds a master's degree in Oriental medicine, as well as a bachelor's degree in psychology. And he's a licensed acupuncturist and licensed massage therapist. He's been in practice in Lower Manhattan in New York City for the last 25 years. Thank you, Tim, for joining us.
Thank you. It's nice to be here.
So talk a little about your journey. I mean, how did you get to be an Oriental medicine practitioner and a massage therapist?
Yeah, that's a good question. It was quite the journey. I started out in life being interested in arts. I was a saxophone player. I was always interested in, spirituality and stuff. So at a certain point, I just kind of switched and got serious about the healing arts. And just being practical, I went to massage school here in New York City at the Swedish Institute, and it was a pretty rigorous program. So, and then from there, I set the goal to study acupuncture and get licensed, and that took a while because again, it was a rigorous, like a master's degree program, and I had to go and pick up a bunch of science credits. So I found myself at the community college, and for a couple of years to get the 60 credits I needed to get into acupuncture school here in New York at the Tri-State College of Acupuncture. And at that school, the guy who owned the school was very clever, and he had developed a technique to use needles, acupuncture needles, to bring about trigger point release. And so that's where my whole introduction to trigger point therapy came in. And so I guess I'll just kind of go into that a little bit. So trigger point therapy was developed, at least from what I know, by a Dr. Janet Travell. And she was actually worked with John Kennedy, the president, and who had Graves' disease and had all kinds of pain issues. And she wrote a couple volumes also about trigger points. So trigger points are areas in the muscle that display exquisite pain when upon pressure. So that's one characteristic. The other characteristic of trigger points is that they have a referral pattern. So you could have maybe pain here and the pattern would go down the top of the shoulder, for example. So she set about to map this and produce 2 volumes on trigger point therapy and myofascial release. I think that's the name of her books. So fast forward to my mentor, Mark Seam at the Tri-State College of Acupuncture here in New York City. He basically just kind of like engulfed himself with her book and instead of using like hypodermic needles, which she was using, he used trigger point, or I should say acupuncture needles, which are much finer and, less intrusive. So the idea is that you find the tight spot, and if you press on it and there's a referral, then that's a trigger point. And you can get the muscle to release. You can do it also digitally, like it's a massage technique as well. And when you get the point and you can get it correctly, the muscle will kind of like fasciculate. It'll kind of jump around, It's a very strange, kind of a unusual feeling for the recipient of who's receiving the treatment, but it's very effective with pain syndromes. And it is a muscle technique, a myofascial technique. It's not really It doesn't have anything really to do with, discs or spinal alignment or anything like that. So it can be a very clean technique where pain is concerned.
So I know, you brought up discs, and what I do know about discs is that they've known since the 90s through studies with MRIs that a lot of people have degenerative disc disease.
Yeah.
They're almost everybody does by the time they reach their 40s or so.
Yeah.
And a lot of those people have no pain. And it's such a common finding that it most likely has nothing to do with the pain that people are feeling. And yet they're often steered to surgery because that's identified as the cause. But in fact, it may not be that at all. It may be a situation where the pain can be resolved with the kind of techniques that you're talking about, because
True.
it's really muscle pain.
Yes. Yeah, absolutely. And that's one of the, that's definitely, if you're kind of following a protocol, then you definitely want to, try to solve things through the muscles first before you get into that whole complex, the complex arrangement of vertebra, disc, nerve roots, that whole thing. And yeah, it can lead you into um, a place that is kind of worse than where you started often.
Mhm.
So,
Yeah, I mean, I don't know how many people you see in your practice over the 25 years who have had failed back surgery syndrome and might have had even multiple back surgeries and just really got worse over time.
oh,
Have
sure.
you, and
Yeah.
are you able to help people like that?
Yeah, absolutely. Yeah. It's, when you think about it, the way I think about the whole musculoskeletal system, it's kind of like a tension, it's like a suspension bridge in a way, like you have tension and that's what holds everything together. And for the most part, the muscles hold that tension. They have like a baseline of tension. And so if it's tighter on the right than it is on the left, for example, your gluteus medius or your quadratus lumborum in the lower back, um, if it's tight on one side, then that's going to pull things from the left. And so the idea is to, release the tight muscle there so that the other side muscle can maybe strengthen or become more tense, and then you bring things back into balance. So the muscles are really important, not only for movement, which is what we think of, but also to keep alignment, from the left to the right. You have all this compensation and stuff that goes on. And that actually might be a good segue into the discussion about fascia,
Mhm.
um, being a type of connective tissue. The way that it was described to me is that it's kind of like a wrapping, and it wraps the muscles, and it's a tissue that is less vascular than muscles.
Mhm.
So muscles are pretty, it's pretty easy to warm up a muscle. Like the blood goes in quickly, and massage is very good with that for that. But the fascia is a little more stubborn. It doesn't have as much blood flow, so it takes a little longer for it to warm up to get the blood to come in. So the technique is very different. If you want to address the fascia, particularly, of course, you're
Mhm.
working on the body, so you're affecting everything. But the fascia technique is more about slow stretches, and there is a technique that you use, with your thumbs, where you're rolling over the muscle. For example, the erector spinae muscle. You kind of do a cross fiber technique, but it's not like a physical therapy thing where you're rubbing it. It's very slow. And there's a lot of stretches that have to do with um, lengthening or elongating the fascia trains, as they call them. And so since the fascia is wound, or kind of like a bandage, if you will, around the muscles, if you can get the fascia to release, then the muscle will relax. And so having an understanding of the complexities of these multi-tissue structures, if you will, is really helpful in getting in health, spinal health, and as well as other parts of the body.
So I noticed on your website that you mentioned that you have some training in rolfing, and I've had a lot of experience as a patient with rolfing. It's gotten me out of, in one case, 14 years of barely being able to walk because of a foot pain problem that the conventional doctors and practitioners just couldn't figure out.
Right.
And 2 sessions of rolfing, I felt like I had a new foot. So what's the difference between rolfing, which is a very intense manual therapy, and myofascial release?
Yeah, rolfing is very intense.
But worth it. I mean, my experience is it's worth it for the relief that you get.
Yeah, absolutely. Yeah, rolfing is very effective for what you're describing. It's interesting because rolfing attends to fascia as well. They talk a lot about fascia in rolfing, but the technique is different. I'm glad you brought that up. The myofascial release is more, it's really more about slow, long stretches. Whereas rolfing, in my experience with it, it's a little bit more focused and in certain areas, so it's a little bit deeper of a technique. You might be using your thumb or your elbow a little bit more. With myofascial release, you're going to use, for example, simple things like if someone has a frozen shoulder or shoulder issue, you can do like an arm pull. So literally you're pulling on the arm, traction. So you're kind of pulling out, or, the joint, you're pulling the joint away from the torso. But where you grab is where you hold the arm when you're doing the pull is important. And it's a slow, lengthening kind of a stretch. So you might spend, I don't know, if you're really focused and you're doing it well, you could easily spend 3 or 4 minutes just on one arm pull, just on one movement. So it's a more of a controlled, slow type of a technique.
And when you say stretch, you're talking about you as the therapist stretches it. It's not a stretch that the patient does.
Exactly. It's a manipulation. Yeah. The therapist stretches the patient's arm, pulls on it. And another really effective stretch, like for example, for the back or the lower back, is the cross stretch, where you're going to, as a therapist, put your hand on like the lower rib area and kind of sink in. You sink in. Sorry, I was painting today, so.
Oh, that's all right.
So, you kind of sink in and try to contact the fascia, and you feel warmth. And so that's the softening. And then you actually push. So you're going to push towards the head at the lower rib area. And then you're going to push towards the feet in in the hip area, if you will. And that's a good way to lengthen the tissue, the fascia tissues in between those two, in the lower back lumbar area. That's another way to create this lengthening idea. And then there are other stretches that come into play as well, like comes to mind the PNF stretches, where you will take a limb, like it's very good for the hamstring to elongate the hamstring. That also affects the fascia as well as the muscle. And that's kind of like a contract, relax type of a technique, where you'll take the hamstring, bring it into a stretch, and then you have the patient contract so it presses against, tries to bring the leg down while you resist. and then the patient relaxes and you take it into a deeper stretch. So that idea of getting the muscles to contract and relax is also a way to help to kind of reset the baseline, the muscle spindles, which sets that tension point. You know, again, we're back to like, what's the base tension of a muscle in order to maintain the structural integrity, the balance of the structure.
So how do people get to the point where they need this kind of therapy? Is it injuries? Is it chronic stress? You know, what puts people in a place where they have these muscle and fascia abnormalities and they could benefit from this kind of therapy?
Certainly injury. If someone is recovering from a, like a surgery, like if somebody has a fracture or something and they go through that whole process, then they're released from, the hospital, if you will, from the doctors. Okay, you're cured, your bone is now mended. Well, then, there's a lot of soft tissue that's all bound up. So this is a way to help to open that up. And other like normal things. I just had a client the other day who came in, and this is a guy who's very fit, does a lot of yoga, and he and his wife recently bought a house, so they moved, and he went to pick up a box, and his back like kinked up on him, and so he was quick to call, and he came in, and we did a very effective treatment just for his lower back. And so, he kind of caught it quickly before it starts to, compound on itself. So either of those are good situations to engage these techniques.
So overexertion injuries like this person had.
Yes.
Yeah, my foot problem started with a foot surgery for a bone spur in my big toe joint. And while it was healing, I was walking abnormally on the foot, so I wouldn't stress the incision as it was healing. And what nobody could figure out for 14 years is that because of the way I was using my foot, the fascia and the muscles and tendons and everything shortened on one side. And when I tried to use my foot in a normal way, it just wouldn't go that way.
Wow.
It's very painful. And for some reason, for 14 years, nobody could figure that out until I went to Rolfer. So how uncomfortable is this therapy, and how enduring are the benefits? Let's say you're talking about somebody, not with a recent injury, but somebody who's had chronic pain and a long-term issue for a really long time.
How uncomfortable? In general, the myofascial release technique is pretty comfortable, actually. Sometimes the arm, if I'm doing the arm stretch, sometimes that can be a little bit uncomfortable because you're taking it into the place of discomfort to get it to warm up and release. So you have to kind of engage the discomfort, engage the pain a bit. Some of those stretches on the back that I was describing, like the cross stretch, those are pretty comfortable. Those are, because that's all about just getting the area to warm up and heat up. And those stretches are pretty, they're actually pretty gentle stretches. So it kind of depends on what area of the body you're working with. The trigger point stuff, back to that, is definitely a different kind of a sensation, because when the muscle releases, it literally just kind of flaps around, and so if you're not used to it, that can be a little bit disconcerting, because we're not generally used to feeling that kind of a feeling. But I have to say that the release of the trigger point is not so painful, just kind of an unusual sensation. And then with acupuncture, of course, people, have this kind of like, kind of sometimes have a phobia about needles, but the acupuncture and needles are very different from what you experience in a doctor's office because they're thinner and they're not hollow, they're very thin. So the actual insertion is not nearly as uncomfortable or painful as, getting blood drawn or something like that. So, culturally we have that kind of subconscious kind of a memory in our minds here in the West.
Well, it's an invasion of our exterior,
True.
in terms of, we don't like to have our surface pierced.
Yeah,
But I've had a lot of acupuncture, and I find it, there have been many situations where I found it very helpful. So how do you differentiate when somebody comes to you with chronic pain, whether to use acupuncture or whether to use, manual therapies for trigger point release, or whether to use myofascial release techniques? How would you decide that? And would you combine them sometimes?
I do often combine them. Sometimes if it's another great use of acupuncture, if I might insert here, is it's really, really profound on the nervous system.
Mm-hmm.
So you can use like classical, just traditional Chinese medicine style of acupuncture without the trigger point, and you put the needles in, basically on either side of the spine, and they affect the nervous system, and the relaxation result is profound. Like people really relax well. So sometimes I'll use that as a technique. And then when the person is very relaxed, they're a little bit more open to using, going into another modality. And I tend to use, what I feel is going to help the most. And I do mix. I don't have a problem with mixing the modalities. Um, if it's a, it's, I don't know. It's almost kind of an intuitive thing when I make the decision, to tell you the truth. I
Mm-hmm.
don't have a specific like protocol for, if this is happening, then you do that. And it has a lot to do also with what I think is going to be most effective, and also what the client is, kind of how they are. It's some people have different tolerances for different things, and you kind of get to know the person, and kind of figure that out as you go, quite frankly.
Mm-hmm.
And then some people are more comfortable with acupuncture because it's a little bit less, whereas you're obviously piercing the surface, obviously when you insert the needle, but it's not, in a way, it's less, shall we say, kind of intimate, if you will, less personal, because you don't have that contact, that skin to skin contact as much. You find the point, obviously you're touching the body, and then you put the needle in, and then the work is done with the needle. So it's more about, you palpate and you find the knot, and you put it in, or you find the point and you put it in. You're not doing a lot of, if you will, like rubbing, or the contact is less. So that's kind of an interesting difference that I've noticed over the years. And, you just kind of obviously you respect people where they're at, because you want to have the most efficient therapy that's going to help them. So, yeah.
So one of the things I've been looking at a lot, because of the situation we're in with COVID,
Yeah.
is the different pain treatments and how they affect the immune system. And I've been wondering, acupuncture is good for your immune system, but I'm wondering if the treatment that you might do for chronic pain would also be, the same needle points or whatever, if that would also boost the immune system, or if that would be like a separate treatment.
I would think that the immune system treatment, which by the way, I think is really important for coronavirus, recovery and after you're, obviously you're no longer contagious, and then you have these long-term results, which we're finding. The immune system treatment is more of a classical Chinese medicine protocol, where you're going to take the pulse and then you're going to use based on that pulse and tongue and what the person shares, describes as signs and symptoms, and you're going to choose your treatment based on that, your points that you use.
Mm-hmm.
The trigger point is more done through palpation. You find that, they describe their problem, and then you're going to palpate, like the upper trapezius, find the knot, needle it, release the muscle, and you're good, So obviously those two things can combine. I would think, if anyone's ever had the flu or just a bad cold and they're coughing a lot, once you get through with that, your muscles are tight because you've been coughing for a couple of weeks, So you could easily have trigger points from that type of an experience. So there obviously is an overlay. But in terms of immune boosting effects of acupuncture, probably the traditional Chinese methodology is going to be, something you're definitely going to use.
I can remember, a visit I had scheduled with an acupuncturist for tendonitis in my arm. And in the meantime, I developed a Lyme infection and then had an allergic reaction to the antibiotic. And
Oh,
I showed up in the acupuncturer's office with hives and a swollen face and this, Lyme infection, and
right.
help me.
Yeah, that
And I
may have
think that
changed his treatment strategy. Yeah.
yeah, it did, but it was helpful as I
Yeah.
was, quite concerned. And I ended up, fighting the Lyme without taking any more antibiotics with acupuncture and herbs and homeopathic remedies. So, and it worked out. I was okay.
Yeah, yeah. Acupuncture can be helpful with those types of things, skin issues, because it can actually help with the blood. Something like that is like a blood level, and so that kind of takes you out of the realm of the myofascia and deeper into the body in terms of body systems. But it's important to understand, from an acupuncture point of view, which level of the body you're targeting your treatment. But that's rule number one, as I'm sure Cindy. The patient calls you up and says, "Oh, I got a sore lower back." Well, okay, we'll see what your problem is when you arrive, because things
Yeah,
change.
things do change. So is your practice primarily focused on chronic pain, or do you treat other kinds of conditions? Like, would people call you up front with, needing some immune boosting or treatment for some other kind of disorder?
Yeah, I get calls for all kinds of different things, and often in doing alternative medicine, people come to you after they've kind of exhausted other issues, other possibilities, normal treatment or medical treatment or whatever, or people are kind of tired of the side effect of taking certain drugs or steroids, that kind of stuff. So in general, people think of me in terms of pain and stress, but but I also have done many treatments on other types of other issues, including what you're talking about, like skin issues. Um, there's a lot of gynecological treatments that you can give that are helpful in terms of menstrual pain and PMS, stuff like that.
Mhm.
Um, there's a
Fertility?
Yes, fertility, and acupuncture is also very good for like people who are just kind of run down, and they get into those kinds of medical conditions where they never get their energy back, you know. So that type of those type of syndromes are really good for acupuncture as well.
Yeah, and I think that a lot of people with chronic pain have other conditions. You know, it tends to be that once you have one chronic condition, you get more. And I think
Yes.
that tends to be because they have common roots. And if you go to conventional medicine, they treat them as separate things, but they're actually, you know, chronic stress, history of trauma, poor diet, you know, sedentary lifestyle. You know, that's really at the root of a lot of this. But
Yes.
in conventional medicine, they're just treating you for that, you know, one disease, and it doesn't really get you better. So, so can you talk about a patient or two that would be a good example of how beneficial your therapies can be for someone in chronic pain?
Okay. Well, I did mention this guy who came in the other day, and he's a pretty much a consistent client who looks after himself and is more proactive. Um, yeah, some of the treatments I've given recently, I have one client who is having some problems with her shoulder, and it's starting to be a little bit chronic. And I'm wondering if it's kind of moving towards like a frozen shoulder kind of thing. And one thing that's important, that's helpful, is to for the patient or the client to come consistently. Sometimes in the chronic pain world, you, like, for example, frozen shoulder, it it's not going to help that much to do a session every 2 weeks. It's
Mm-hmm.
going to help more if you can come twice a week for 3 weeks,
Mm-hmm.
because what often happens is you you do the treatment and you make an advance, and then by the time they come back, it's like backtracked back to the original problem. So you want to have a good sequence, a good frequency. Like, you do the treatment, and then the person has like a recovery period from the treatment. You want to get the toxins to flow out, drink fresh water, sleep well. That's where the healing comes in. Maybe take 2 days off and then come back, and then you're working from your starting place. This, ideally, the next session would be in a better place. You're starting in a
Right.
more positive place.
Mm-hmm.
um so that's something that I try to look forward that I look for. And then people who have, the thing about having chronic pain is you kind of have to have patience. You have to give it you have got to give it a chance. You can't just like say, that's another thing with the Western mindset. It's like, oh, give me a pill, I'll feel better tomorrow, I'm back to work, or tomorrow I'm 100%. With chronic pain, it took a while to get you to this place. That's why it's called chronic. Well, it may take you a while to kind of get you out of this place too.
Mm-hmm. Mm-hmm.
um, so that's the main thing that I would encourage people to, give it a chance. And you know and it's okay to do 2 sessions a week. That's another thing that we're so kind of focused on here, is having it be immediate and, get me out of here kind of thing.
So, what's a typical time frame for something that's chronic? 2 times a week for, I mean, is it highly variable? What does it take in terms of the benefits to last, as opposed to, let's say a nerve block lasts a few weeks or a month or so. What does it take for a more enduring benefit from acupuncture or myofascial release or those other therapies?
Yeah, a lot of it depends on the kind of like underlying health of the individual, like the vitality of the person.
Mm-hmm.
Here's a good example of a case study. I had a client a few years ago who was a violinist, and she was part of a quartet, and they just, they were very ambitious and very focused and organized, and it was classical music, and they played a lot and rehearsed a lot and traveled a lot. So there was underlying stress, but she was this particular artist, this person, she had good vitality, and so she came in, and it was very much an overuse kind of a syndrome that was starting to become chronic. And I gave her, I don't know, 4 or 5 treatments, and she was much better. She
Mm-hmm.
really responded well and improved well. And so after that, then it was like, oh, come back every 2 or 3 months, to keep you in operation.
Mm-hmm.
Um,
Mm-hmm.
Conversely, I had another client who he was experiencing like heat all over his body and itching all over his body.
Mm-hmm.
So in Chinese medicine, that's itching is called wind. It's a type of wind. And then the heat and the itching, it's then once again, you're looking at kind of blood level. I gave him a couple treatments, and he said that he felt a cessation of these sensations for 20 minutes. And I was like, okay, 20 minutes, because sometimes these things can be stubborn. I said,
Yeah.
good, that's positive, 20 minutes.
Yeah.
Let's,
A shift at least.
exactly,
Yeah.
but I think he got frustrated, and so I wasn't able to like convince him to come, and give it a ride, give it a real trust for him, or something like that. I would try to have the person come in for twice a week for like 3 weeks,
Mm-hmm.
twice a week for 4 weeks. And if we haven't found any shift, like you're saying, like any kind of positive result, even something small, then, I don't want to like, I don't want to waste your time. I don't want to waste your money. But anything less, if it's a chronic thing or something that's like deep, in the body, you have to be willing to like make some kind of a commitment to it. So, in this world where we live, 3 or 4 weeks, twice a week, if we haven't found anything by then, I'm not going to try to press, continuing treatment. But that's a good that's a good barometer, to
Mm-hmm.
try to see if you can get a shift, get something started, get something positive happening.
But it
And
may take longer to get the optimal durable result.
exactly, yeah, it may take longer, and sometimes things will show up in the pulse, that in Chinese medicine, we have the different pulses, and I might be feeling positive because the pulse has shifted, but that doesn't reflect in the person's experience, immediately.
Right.
So, and then obviously, if you can get a shift to happen, then, the commitment will increase, and then maybe you can work for 3 months, 3 or 4 months on something chronic, and little by little, you're able to kind of get them out, bring them out of the woods.
Mm-hmm. Mm-hmm.
Um,
So whenever you talk about alternative medicine, there's always the question of, does insurance ever cover this?
right.
So
Yeah.
does insurance ever cover what you do?
Occasionally, yes. People have acupuncture on their insurance.
Mm-hmm.
Um, Recently, I think in massage, that it's possible now to work on workman's compensation. So if there's something happens at work, then it can be covered by insurance. For the most part, I work basically for cash, and it really has to do with the type of insurance that the patient has.
Yeah, my experience too. I'm a biofeedback and neurofeedback provider as well as a psychotherapist.
Hmm.
And I find that oftentimes no fault auto insurance will cover more alternative medicine.
Okay,
They will
that's good to
often
know.
cover biofeedback, massage, acupuncture. If they have a stake in getting people better, because otherwise they have, big payouts. then they're,
Right.
that's the case with workers' comp also. They have
Sure.
more of a commitment to getting better because it affects their bottom line, where your typical health insurance, is not impacted by that. So,
Right.
yeah.
Well,
Yeah,
that's
I
good advice.
understand that Medicare is going to or has started to pay for acupuncture for chronic low back pain.
Oh, that's good to know also. Very
Yeah,
good.
yeah. I mean, it's very limited, just low back pain.
Right.
Um, but, hopefully there'll be more openings for that. But, the financial issues are, really important for people, especially people in chronic pain who, may be on disability or have it really affect their productivity so that they're very financially challenged.
True. Yeah, the chronic pain, there's really nothing worse than chronic pain. It just kind of beats you down, you know. You're
Hmm.
always in pain, so you always have this underlying, uh, kind of energy going on, and you're wondering if it's not so bad one day, you're wondering when it's going to come back, and, it zaps your energy.
Yeah.
Yeah.
So I know you have a degree in psychology. Does that come into play in your practice at all? The whole
Yeah,
mind-body relationship?
most definitely it does with the clients. And when you do these kinds of treatments, people are first of all, sometimes emotional stuff will come up, right, during the treatment, so it really helps to be able to handle that and manage that. And it's also helpful in terms of motivation. What is this person motivated by in terms of being consistent or coming back, and for treatments. And also people want to share, they want to share what their life is, what their stressors are,
Hmm.
what
Hmm.
what their goals are, what their dreams are, what their frustrations are. And on a therapeutic level, often there's a connection, like a direct kind of almost metaphysical connection between the issue and some emotion, like lower back pain and anger is often associated.
Hmm. Hmm.
And my client that I referred to earlier was definitely he was in a frustrated place in terms of his life and the coronavirus and all this stuff. So I wasn't surprised about that. Sometimes just being able to listen to a person share their story is a big relief for
Hmm.
them, and then they're more open to receive the treatment. So it
Yeah,
definitely,
yeah,
yeah,
that's something that conventional medicine has really lost. When you think of the old family doctor and how they used to be really healers, like, someone who would hold your hand and care about you
yeah,
and be with you through troubled times and challenges. Now it's been corporatized. Doctors, practices are bought out by hospitals, or they're part of big groups because they need to defend themselves against insurance companies. And
right.
so somebody else is telling them you can only spend 10 minutes with each patient or whatever. So conventional medicine has really lost that, where I think in alternative medicine, there's much more of a commitment to, retaining that kind of healing presence and that kind of relationship.
Yes, I agree with you. And the shortness of the treatment time, definitely limits that. And also there's a tendency kind of in the medical profession to like think of yourself as a scientist. I'm a scientist, I'm reading your blood, your blood work, this. Obviously all that stuff is important, especially, with whatever they may be dealing with. But it does tend to take away the human element, and
Mhm.
so yeah, I agree with you. The alternative healing arts I consider myself to be in alignment with that, like the healing, more of a healing modality type of an approach.
Mhm. Mhm.
So like I'm also a Reiki master, which is kind of
Mhm.
working intuitively to help people in their psyche to come
Mhm.
along.
Mm-hmm.
Yeah.
Mm-hmm.
And then and of course with each individual you have to make some kind of an assessment around that, how available they may be to, you know, share their insights or, you know, this type of a thing.
Or get into anything spiritual or anything as like, a lot of people think of energy as really out there, but it's just very interesting what's happening in the pain management field with all these electrical devices coming out that are
Mhm.
very useful for pain. The body's an electrical system, the
Right.
brain's an electrical system, and that's something that conventional medicine has been ignoring, for hundreds of years. But it's something that really is a critical part of, a person's health. And there's many ways to intervene in that electrical system that can be very beneficial. And one of them is acupuncture, and another one is, energy healing techniques like Reiki.
Hmm. Yeah, it's really interesting. And historically in this period of time, how this interaction of science and spirituality, if you will, is kind of starting to integrate
Mm-hmm.
somewhat, you know, and
Mm-hmm.
that's really exciting because you can look, like for example, with acupuncture, they talk about qi, and it's ancient. You know, it's like these theories come before things were written down specifically, you know, and so now it's almost like things are coming back around. You know, if there's a way to measure electricity, which at some point in time was thought of as a concept of chi or energy, you know, this is a way to kind of for things to come together, to integrate. And so the separation is not so strong between
Mm-hmm.
science and physical health and a spiritual or metaphysical kind of point of view or
Mm-hmm.
interaction.
Mm-hmm. Mm-hmm. So, is there anything else you'd like people to know about these therapies or your practice?
Well, basically, I'm here to help the person with their whole, you know, their whole body mind, if you will. And that's one of the things about Chinese medicine that is very different from Western viewpoint. They really see it as the goal is harmonizing the different energies of the body, the different organs, the different tissues, the different, you know, channels, meridians, if you will. The goal is harmony, harmonizing so that the different parts of the body are working together.
Mm-hmm.
And so it's not really a piecemeal kind of like pull something out, fix it, and put it back in kind of a type of a concept. And the other thing that I offer is that since I'm not a medical doctor, I can offer more time in my session. So I do like to take the time that's necessary to get a good, strong effect.
Mm-hmm.
And that's something that people don't always get when they go to a medical doctor or a medical clinic, if you will. You know,
Or
situation.
almost never.
Yeah, if ever, yeah,
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 I mean, I tend with my practice to spend at least an hour in each session with each person. And
yeah,
that's, you just don't get that out of a doctor.
right, yeah,
So it's just very different. And one of the things I like about alternative medicine is that it acknowledges the body's innate healing system. If we give the right circumstances to the body, the right conditions, the right raw ingredients like diet,
hmm,
uh, the right mindset, the right stimulus like, an acupuncture needle or a
yes.
stretch, whatever. The body knows what to do with that. It's a natural intervention, and it sets off a cascade of healing in the body that is very different than conventional medicine, where you're just trying to tamp down a symptom usually.
Yes, and that what you just said is very, very consistent with Chinese medicine. It
Mm-hmm.
really is about giving the body a nudge, or with acupuncture, often it's like unblocking a blockage,
Mm-hmm.
and then that sets up like you said, a cascade or a domino effect where the body can kind of reharmonize itself, bring itself into a stronger state of homeostasis, and thus function better as a whole, and hopefully pain-free as well.
So tell people how they can get in touch with you. You're in Lower Manhattan, you said.
Yeah, I'm in Lower Manhattan, and you can reach me through my website, strategichealing.org. And my email address is timc@strategichealing.org. So look me up. I'm available.
Great. And if they forget that, they can also find you on the Alternative Pain Treatment Directory, which
Yes.
is paintreatmentdirectory.com. And if you are listening to this and you don't happen to be in New York City, search our provider directory, because we do have people around the country who do these similar therapies.
Very good.
So thank you so much for speaking with me, and we'll talk again sometime.
Okay. Thanks, Cindy. It's great to be with you today.
You too. Take care.
Okay. Good night.
Night.